The topic today is what illnesses can iridology reveal? I'll repeat that so you get clearly what the whole system is about. What illnesses can iridology reveal? I can tell you that is a very potent question, but I need first of all to go back to 1976. That was one of the turning points in my life. You know, there's sometimes in your life where you see the road and it's left and right, and you've got to work out whether it's that road or that road. Well, that particular day, I went and visited for the first time ever, I visited an eminent chiropractor called Dr. Tony Human in August 1976. And normally, as you know, a chiropractor will manipulate your back and will work out what ligaments are out, what vertebrae are out, and so on and so on. But this particular chiropractor, he did something that I didn't expect him to do. He sat me down, instead of lying me down and then working my back out, working where the pressure was and the problem was, what he did, he actually got a torch and a magnifying glass and he looked in my eyes, both eyes. And I thought, I was 30 at the time, and I thought, wonder what he's looking in my eyes. He's a chiropractor. He should be doing my back. No, he looked in my eyes first. So he looked in my eyes, and I could hear him, that good 5 minutes on each eye. Then he put his torch away, and then he went back to me, and he's sitting me down. He's like, looked again one more time. I remember the whole procedure, and then he said to me, "Okay, I know what to do," and he lowered me down, and you know, the vertebrae, this is what really got me thinking, because the vertebrae starts here, you know, beyond the skull here, and that's the first lot of cervical vertebrae. Then you got thoracic vertebrae, then you got lumbar vertebrae. And he went, because of the army, I'd spent time in Vietnam and I was carrying packs of 80 pounds plus equipment. My lower back was really playing up at the age of 30, and this is 10 years earlier I'd been in combat. And it was really painful. So he went, but he didn't go to the cervical vertebrae or the thoracic vertebrae. He went straight to the problem where the lumbar was, and he adjusted it. And within about 10 minutes, I could feel the relief. And then I thought, I was curious what he was doing. And I said at the end of the 10 minutes of working my back in shape, I said to him, I said, "Tony, you're a chiropractor. What are you doing looking in my eyes?" And he went like this, "It's iridology." And I went, "I've never heard of it. 30 years of age, I've never heard of it." He said, it's the ability to look at your eyes and work out what's wrong in your body. "What do you mean what's wrong?" I said, he said, "You've been looking at this drawer in there. What are you doing?" So he pulled out, he went over and he picked up a black and white chart in 1976, a black and white chart like this. And I was like, wow. What is that? Iridology chart. But it was black and white at the time, which was in 1976. Now, so then he was able to point to me a spot here, right where your actual spinal column is located in the eye. It's right there. So on the right eye, it's here at about 4 o'clock. And then in the left eye, it's about 7:30, 8 o'clock, 8:30, right? So that's the right side of your back. Here, like this spot, and it's the left side. And I went, wow. I said, "Have you got a book on this?" He said, "Yes, I have." And he lent me a book by a nurse called Dorothy Hall, and she was also an iridologist, and Tony had learned from her and his dad. So I became very friendly with Tony. I went back, visited every 3 or 4 weeks, got my back adjusted, and then he said to me, he said, look, he said, "You should do this. You should pick this up and then learn. And then one day you'll be able to practice." I said, "Okay." And so I've since found out, since 1976, that you can discover up to 86 illnesses. 80 in both eyes. Imagine that. Imagine the ability and the skill. You can look at somebody's eyes and you can see 80 things looking at both eyes. 80 things. Now, I'm a very logical, intelligent thinker. I thought, how does that happen? How can the eye be marked like that? How can that happen? And it turned out it happens because every single day, that's a scientific fact, Every single day, the human body sends 28,000 signals. I'll repeat that. It sends 28,000 signals from your spinal column. Millions of nerves go in, goes in the spinal column, goes to the optic nerve, and your irises, which are the colored part of the eye, is marked with the corresponding mark. So it could be your back, it could be your thyroid, it could be your lungs. Every major organ and minor organ is seen in the eyes. Now, so we're clear about it. When you see the eyes, now most people look at the eye as one item. It's not. It's actually three items. You've got the pupil, right, which is the dark part in the middle. You've got a pupil. Then you've got the iris, which is the colored part of the eye. And then you've got the sclera, which is the whites of the eyes. Now, remarkably, I found out along my studies that the word iris is actually an old Egyptian word meaning rainbow. Iris meaning rainbow. Now, in the world of iridology, you've got blue eyes, you've got green eyes, you've got a mixture of blue and brown, you've got a mixture of blue and green, you've got dark brown, you've got dark, really dark, like the Zulus. Very, very dark. They naturally love that. Very hard to read. The easiest eyes to read, blue-eyed, blue eyes, green, hazel, and to a certain extent brown. They're the easiest to read. But you have to do a lot of 4 or 5 years of study to understand every type of color, right? Now, so the illnesses that can be seen, it could be to do with your thyroid, your liver, your gallbladder, your kidneys, your stomach, your pancreas, right? Your ears, your vision, your pain in your shoulder, left and right, pain in your forearms, pelvic area, thigh, knee, ankle, and so on and so on. So if your spleen, all these organs can be photographed in the eye and can be seen. So then what happens is, this is where I'm unique. I've done about 40 years now of iridology, but I've also done 60 years of nutrition studies at very advanced level. Everything to do with proteins, carbohydrates, fats, right, and so on and so on and so on. So I'm a very forward mixture where I understand the iridology component, which is to do with sizing up and finding out where the disease is, and then recommending the appropriate treatment by way of nutrition and supplementation to get the maximum result for the patient. Right? So if you like this video, press the button down below, and you can request you can request to see the videos. Adjust to it, like what they call abonné, to join the script. You can also order 2 booklets, best ways to treat diabetes and psoriasis, and then you can also get the books on the best way to get an iridology consultation, and also this one here, the benefits of having an iridology consultation. Now, once you do it pays you to order, to get those books. It's digital. We don't charge for that, but we've written a lot of hours, a lot of very, very potent stuff in it. Ask for it, bring it to the digital system, read it, and then give us a call, discuss with what you're suffering from, and then we can organize a consultation for you, and then we can give you some really, really good treatment on how iridology can support you with recovery from any illness you've got, major or minor. So thank you for listening. We look forward to talking to you soon.